All right. Hi, everyone. My name is Dr. Peter Nguyen, and today I decided that we're going to do a video series on health and wellness. So I am a general dentist here in Katy, Texas, and I've been practicing for almost 10 years now. And so the reason why I wanted to do this video series is because I wanted to bring some health and awareness to the local community. And so in each of these series that I'm doing, I'm going to be introducing you to local health professionals, whether it's in dentistry, chiropractics, pediatrics. So, the more health and wellness we are aware of, I feel like would be very beneficial to everyone here. And so, feel free to give me some thoughts and comments below. If this information is helpful to you guys. But without any further ado, I want to introduce you guys to my very first guest. He's a very good friend of mine, Dr. Adil Khan. I've known Dr. Adil for over 12 years now. 12 years, that's a long time, buddy.
Yeah, it is a long time.
Yeah, so a little backstory is that we actually had both gone to dental school together. And after dental school, we both kind of diverged a little bit. So I went into general practice, general dentistry, which is family and cosmetics. And Dr. Adil actually went on to becoming a pediatric dentist, specializing in kids. Yeah. So Adil.
Yeah, Peter.
Yeah, cool, man. How you been, man?
I've been good. I'm so excited to do this on you for your first vlog. This is going to be awesome.
I know, this is going to be awesome. I know. I don't even know how to anticipate this. So this is going to be awesome, though.
Yeah, so let's talk about baby teeth, shall we?
Baby teeth. So first of all, let's give our audience a little backstory here.
Sure.
What made you decide to go into pediatric dentistry?
Yeah, sure. Very good question. So I actually did not know that I wanted to specialize till the very end of dental school.
Okay.
And one of the reasons that I realized that this was my calling to say, not to sound too cliche, is because we had our pediatric rotation, and for me it was ended in the very last few months of dental school. And that's when I realized that kids present a unique challenge because most of them do present to you or come to you and they're anxious and nervous about dental treatment or what may end up happening at that visit, right? So this was an opportunity and a challenge for myself that I thought, wow, this is incredible. You can take an anxious child who is nervous about dental treatment and kind of transform their experience and into a positive experience and hopefully make them into a lifelong fun, excited dental patient that looks forward to coming to their dental visits. So I really thought that was the main thing that attracted me to pediatrics. And obviously, I think my personality is kind of laid back, easygoing. Not everybody's made to be in pediatrics, and I think that helps a lot. And I love seeing kids because each kid is different, and they'll say the funniest and most interesting things, and it's just a lot of fun.
It really is.
Yeah.
I mean, kids a lot of times just say what the first thing that comes to their mind.
Of course.
It's just amazing how bright a lot of kids are.
For sure.
But you're definitely right, though. I mean, having a really good experience while you're young goes a long way because even in my practice, like I see kids and adults too, but just knowing that, hey, if they had a good first experience when they were younger, it really affects them later on in life.
Oh, for sure.
And I'm sure, you providing such a great experience firsthand is, one of your main jobs,
Oh, no,
right?
definitely, most definitely. And there have been actually studies done on this, right? So the earlier a child starts seeing the dentist, the lower the cost of dental treatment or lower the number of emergency treatment that child will experience over the term of their dental life or dental experience. So, the earlier you start, we talk about seeing the child as early as you get your first tooth or by age 1. So the American Academy of Pediatrics and Pediatric Dentistry both recommend having a dental home established, be it a dental home like you, a family dentist, general dentist, a pediatric dentist, any provider that you can see and are comfortable with. So by age 1, every child should have their first visit by their first birthday. And the foundation for their oral health for the rest of their life is really, in my opinion, set in those first few visits where you talk about proper hygiene, good nutrition,
Right.
good habits at home, and you know, keeping everything on track for the future.
Definitely.
Yeah.
You know, it's funny that you asked about your first visits, because a lot of times parents will ask me like, "Hey, Dr. Nguyen, when's a good time for me to bring my kids in?" And when they do come, you know, what are we going to be doing at this appointment? Because I'll get questions like, you know, are we going to brush the kids' teeth? You know, are we going to talk about dieting?
Right.
What are we going to talk about? So
Yeah.
what do you talk to your patients about?
So really, I mean, in most pediatric dentists are very good at this. So it's part of our anticipatory guidance for, you know, their first visit or every visit, to be honest. You know, we go down our list. So we talk about first, you know, any health issues that might be compromising oral health, you know, medically speaking. So we address those.
Okay.
And we also talk about feeding habits. What are they using? Are they on a sippy cup? When to give up the baby bottle? How healthy is it? For how long to use the pacifier for?
How long would you say about that for pacifiers?
Yeah, pacifier. You know, American Academy of Pediatrics actually, and both of us recommend using the pacifier. It's a healthy habit up to age 1.
Up to
Correct.
up to age
but
1. Okay.
After age 1, it's still acceptable. But basically, what that means is that you want to start working on weaning off or having a strategy in weaning off from the pacifier. So decreasing the frequency and its use after age 1, and really having a solid plan. Really, by age anywhere between ages 3 and 4, most definitely by age 4. You should really be weaned off that habit.
Like 3 or 4. Okay.
Completely. I prefer personally age 3.
Right.
And we have you know, different strategies we discuss with the patients, you know, to help them overcome that habit. So, you know, be it pacifier, thumb sucking, lip biting, you know, finger sucking. There's a whole range of digit sucking and behavioral habits that kids present with.
Yeah.
So it's important that parents understand that it can affect their dental growth and development over the long run if they don't stop that habit by a certain time.
Absolutely. Yeah. And, you know, another common question that I get a lot of times is when kids start teething. You know, that's one of the things that parents worry the most about is how do I help my kid out because they're in so much pain. And so, you know, a lot of times parents will give them like a little numbing gel in the area to try to help it out.
Sure.
But you know, I would tell parents sometimes, hey, you know, you want to massage the area to kind of help soothe the teeth from coming in.
Right.
But what do you think is the best way to do it?
Yeah, it's a very good question, and that's usually a common question we get for, you know, our young infants because parents always complain, oh my gosh, our child has been teething, seems like forever. So the two most common you know, symptoms of teething documented are you get very irritable, right? So you're fussy, and then you drool a lot, lots of salivation. So those are the two most documented symptoms of teething. And, you know, other people have anecdotal symptoms such as fever, upset GI system or tummy, but really research has not substantiated or backed up those claims. So for teething, we do recommend using chilled teethers. Anything you can put in a fridge helps.
Okay.
Some people even use some ice chips to kind of get the gums nice and cold, so that helps. We don't recommend over-the-counter teething gels and tablets. So a few years ago, FDA kind of sent a warning against especially the over-the-counter gels and tablets that have benzocaine in them.
Yeah.
Because you run the risk of methemoglobinemia if used in higher frequency. So really, my advice is, you know, chill teethers, Tylenol, Motrin at night when you're really, really fussy and you cannot seem to get a good night's rest. And you know, those strategies work really well.
Yeah, and some of those parents. Yeah, some of those chilled teethers, I've actually came across one of them. I mean, you can get them for on Amazon actually, and they're fruit teethers. You can just put them in the freezer, and then when you're ready to give it to your child, it works really well.
Yeah, it does.
That's pretty cool.
Yeah.
Awesome. Yeah. So and you know, if you guys don't know already, Dr. Adil has actually just opened his office a couple months ago.
Yeah.
Actually,
Hence,
yeah.
this is our friend.
Yeah.
Champasaurus.
Champasaurus. Okay,
Yeah,
so that's a name. Cool.
Champy the Champasaurus. Chomp, chomp.
Cool. Cool.
Yeah.
What made you decide to open this practice here in Katy?
Well, I mean, we've been living in Katy for a number of years now, so this has, become our home. Our kids go to school here.
Okay.
And so we wanted, it was my ambition for ever since graduating dental school to kind of do my own thing. But it just never materialized, and I finally got the courage to kind of go on my own and do my own thing. So
Right.
we chose Katy because we love living here. It has a lot to offer. The families here are exceptional. They do really value, education as well as healthcare, and they value that for their kids as well. So
Right.
I felt like we would fit right in and bring a lot of value and quality work to the families in the Katy area.
I see that you've already gotten yourself into the community pretty quickly. I mean, I think you had sponsored a soccer team, I think, recently.
Yeah.
So that was
So
pretty
we
neat.
ended up sponsoring a soccer team last fall, Katy Youth Soccer League.
Okay.
And one of my kids actually played for them too. So
there you go.
it worked out really well. We were excited to be part of the community, and hopefully we can continue to do the same in the near future.
Yeah.
And continue to let the families know
Awesome.
what we are about.
Yeah, definitely. I mean, now that you're here in Katy, yeah, it's a very bustling community out here. So
lots of families, lots of good families.
yeah, lots of people to get in touch
Good
with.
people for
All
sure.
right.
Yeah,
Awesome.
so I mean, come see us. We are located right next to Costco at the intersection of 99 and I-10.
Yep.
And our practice is called Happy Chompers. That's why Chompy the Chompasaurus. And we're open and fully operational, open for business, and we accept most insurances and Medicaid. And we'd love to serve our community.
Awesome, Adil. Well, thank you very much again for helping me with my first video here.
Yeah.
Yeah.
Hopefully we provided some valuable information.
Yeah.
But, hopefully if you guys have any questions, please post below, and we'd be happy to share more knowledge and hopefully help some families out.
Absolutely, yeah. And we'll tag Dr. Adil in the video too, so that if you guys have any questions, he'll also respond. And we're all about giving advice and about helping the community out. And so the more awareness for your health and for your family that we can do, hey, we're just happy to be able to provide it. So
That's right.
all right, cool.
Awesome.
Until then, we'll see you guys on the next episode. All right.
Bye, everyone.
Take care. Bye.